dedicated to empowering you with information,
to make positive choices,
and be advocates for your overall well-being.
Welcome to The Health View. I'm Yvonne Dunetz. Welcome to The Health View, and welcome to this version of The Health View and the COVID-19 community update. I wanted to update you just a little bit today to let you know that Dick Gagnon from Access Nashua has been very, very gracious in helping the Health View and myself to be able to provide communication to the greater Nashua area related to the updates responding to the community COVID-19. Unusual times we've been living in, and as the community itself and all departments of the city were making arrangements in their coordinated response, we took to the lead to help them keep you updated as to what's going on. Now, effective on Fridays, there will be a press conference coming out of the mayor's office, Mayor Donch's office, so that you will be able to hear the updates from all of the departments. You will be able to see these updates on Channel 96, 99, and 16, as well as on YouTube. Please go and watch the community updates. It's important for you to be informed. And now, as you've noticed for the Health View, we've been doing a variety of segments for you to help you through this difficult time, as well as to inform you in other ways. And there have been many community members and businesses who have come forth to support our communities throughout the United States and the world in helping each of the countries and the U.S. deal with the challenges of COVID-19. My guest today is Marcel Chabot, and he's the founder and engineer from the Amherst Maker Space. And we're going to talk today about the difference his organization has made in supporting our community. Welcome, Marcel. It's good to have you. So what we'd like to do is start off with you explaining a little bit about what is Makerspace.
The closest analogy I can come up for what is a makerspace, sometimes called a hackerspace, is like a gym for for people who make things. The members pay a monthly fee and they get access to the space. And in the space, we have all sorts of tools and equipment and technology that the members use to make what they want. There's a wood shop, a metal shop, 3D printers, laser cutters, CNCs. We even have kitchens and loads of hand tools. It's just lots of stuff so that you can make anything you want without having to have all the equipment in your own home.
And the beautiful thing about how your organization really stepped up at the time of a real community need was you began to help by making the N95 masks. Please tell us what you did and what that took in order to help our community.
Sure thing. The masks were brought to my attention by another makerspace in the area. And to be clear, they're not quite N95, because if we could make N95 masks, we'd be 3M and able to supply them. They're as close as civilians can make. And I have an example here where it's a 3D printed shell with a modified filter mounted on the inside to get as close to the N95 standard as us civilians can make. And we're able to pull together a group of makers from the area that wanted to help 3D print the shells. We have teams that help assemble. We have teams that help deliver them to the hospitals and the community members that need them.
How many were you able to make for the greater Nashua community, as well as in the state of New Hampshire?
This week we should be near on 1,000 masks, just shy of. Probably be 1,000 by next Wednesday.
That's fantastic. And you focused on the greater Nashua area?
Yes, we tried to stay as locally focused as we can. Nashua, all the way out to Greenfield. We have some going off to Manchester. We're doing what we can to fill the needs for people who are able to accept them and use them.
And who did they actually go to? Did
We
they go to
send
the
them
hospitals?
we send them with the people that go to the hospitals. There's some challenges with distributing through hospitals, but people who are able to accept paper masks and other such masks can evaluate ours and decide if they are the right type and fit for where they're working, and they're free to have them if they'd like.
Okay, so that is a wonderful help, especially with the delays of getting the N95s in and all of the things that we're going through. As you know, the community in the whole state of New Hampshire, as well as in other states, have been making cloth masks also for people that are on the line that may not need the N95, but could help them with this mask that had a filter pocket so that the hospitals actually could put a filter in to protect their staff. We've had people from the community angel community project, the Masketeers, the Bedford groups of sewers, people from all walks of life coming up to help us. Thousands and thousands of masks being given to the hospitals as well as to help the frontline people. And there was something that came up related to them, that the elastic related to the mask on the ears having to be worn a long time began to hurt their ears. And that was brought to your attention. And can you share with our viewing audience what you developed in order to help them not to be in pain and have soreness with their ears?
Well, it's a product called an ear saver, and this is what they look like. And there's lots of different ways to make them. You can make them out of cloth with buttons. You can 3D print them, but all of our printers are being used. So a group of us got together at the Maker Space and looked through what equipment we had that wasn't being used and what materials might be available to do that. And we actually found that we could make them out of the flexible plastic that is used for kitchen cutting boards. Those thin, flexible kitchen cutting boards are made out of a plastic called HDPE, and it laser cuts really well. So we're able to place a full cutting board in a laser, run it through, and we get 24 of these out of the laser for every board we put in.
That's fantastic.
And it helps us keep the cost way down because because the cutting boards are cheap, each of these are 3 cents. So we have money that is donated to the Makerspace for this project, and this makes really great use of those funds where we can make thousands of these for dollars. It's great.
Well, it's greatly appreciated. I've gotten feedback from nurses that have already used it and other professionals that it's made a difference related to the pressure on their ears because they're having to wear these masks all day long. And so they're very appreciated. So thank you. How do you go about choosing what types of supports you're going to offer to a community?
It really comes down to what we have resources for as a makerspace. We didn't go with the cloth and paper masks because there were lots of those, but making ear savers required tools that we had that aren't really widespread out. Not everybody has a 40-watt laser sitting in their house, but we have those types of tools at the Makerspace. So we try to pick and choose projects that fit the tools and the resources that are unique to our space that other people don't have. We consider everybody participating makers. If you're making a paper mask or a cloth mask, we're helping your masks fit better with ear savers. We're all just trying to participate and trying to fill whatever niches we can find.
That's wonderful. Are there other things that you are doing with the pandemic right now that needs that you're trying to meet?
We're evaluating other projects requiring 3D printing and laser cutting from other hospitals in the area. There's respirator components. There's other pieces that we may be able to help with that we're evaluating whether we can effectively produce what they're looking for. We certainly don't want to get in the way of people who have better technologies or different tools. We're always looking and reaching out for others that might want to participate. You can go to amherstmakerspace.com and look at what our current efforts are and see if you'd like to help or if there's ways that you can contribute to our projects. Or if you have a need that you think we could help you with, feel free to reach out.
Can you tell us a little bit more about the Amherst Maker Space and how it's unique? I understand that there are maker spaces in a variety of cities and in a variety of states. How is your maker space unique?
Ours is a little unique in that it's a part of the Amherst Middle School. So during the day, when school is in session, the kids use the space and all of the equipment for classes. They have classes where they learn to use the 3D printers. They have classes in clubs where they use the laser and the wood shop, and all of that equipment gets used during the day. And then in the evening, the members can swipe a card and get into the space and be able to use all the equipment that the kids were using during the day. It's really a nice win-win where some of the equipment is difficult to calibrate and difficult to set up. The 3D printers, the CNCs, they all need calibration and tuning and work. And the makers do that, and then the students are able to use the equipment during the day. It's a neat win-win situation.
And do they integrate that within their curriculum?
Yep. The main teacher, Steve Opry, he works all the equipment into his lessons throughout the year. He'll even come to the makerspace to meet up with makers to help design programs that utilize the space and utilize the tools and technology to design new programs and new curriculums around what we have.
Now, with the schools closed because of the COVID-19 pandemic, how has that affected you and your use of the space?
We've had to close down the space for general usage. Usually there's people in there all the time doing their own personal projects, but we've had to close the space for that. We got special permission to open it specifically for COVID response work.
And throughout the other parts of the state, are maker spaces like in Manchester and other spots in New Hampshire doing different things, or do you collaborate together?
We collaborate a little bit. We trade ideas, we trade information, but every space has a different set of team members, different skills, and a different focus. We find that lots of different spaces tend to steer towards tools and skills that are native to their group. Lowell is very much in Lowell, Mass, their makerspace and us. We traded information when we started this project. I know Make It Labs in Nashua is doing quite a bit of work. And the Manchester Makerspace is also participating, each in their own way. A lot of our stuff has overlap. And we just try to stay to what our group is best equipped for to do.
And what would you say you're best equipped to do?
We've got a lot of engineers in our group, so problem solving is what we're really good at. So setting up the masks and printing them and having the community members that are in the Amherst area and surrounding towns that join us for assembly nights and for sorting out problems of how to make the ear savers quickly and cost effectively. But our space is small compared to some of the other larger ones, so we're volume capped at a certain limit of how many people we can fit in there safely with the COVID issues going on.
Absolutely. How can people get involved with the makerspace?
Well, if they have needs, reaching out to us is a great way to get involved. Right now, it's fine to just call and say you have a need. Other ways is that you can participate in 3D printing. If you have a 3D printer, we've got lots of different types of things that need printing. And that's a large bottleneck in the process because 3D printers take time. If you have access to a laser and want to make ear savers, all of our models and everything's online. We're always looking for donations to buy more material. The plastics and everything that we're working with cost money. And through some very generous donations through town, we've been able to keep running for the past couple weeks. So there's always that. Or if you would like to come by and discuss things and how to build or help in any way, we're always open for suggestions.
So related to the COVID-19, are you open or are there other ways that you communicate with people? How might people reach out to you and communicate? Via Skype like we're doing or through FaceTime or telephone?
You can email makerspace at sau39.org. You could go to amherstmakerspace.com, or you can find us at the Amherst Maker Space Facebook page.
Excellent. Can you repeat the website again, please?
www.amherstmakerspace.com.
Okay. So, related to your uniqueness and how you go about connecting with the other parts of New Hampshire, do you also, you mentioned you connect with Lowell, Mass. Do you connect with other states too, related to what they're doing regarding COVID-19 and how they're helping to make a difference?
Not as much. We tend to stay within our group right now. There's some Facebook pages devoted to our type of manufacturing of COVID response and the type of things we're doing. There's several Facebook groups that deal with that, and we all communicate through there and chat and trade tips and ideas and needs through several different community groups, Facebook, and there's a couple on Slack that we got invited to that we will follow along with so we can trade ideas. The need is so great that just expanding past the small radius where we are exceeds our capacity. So each space is more focused on the need in their area. And for us, small groups, it's as much as we can handle. There is so much need right now that reaching out to our friends in some of the maker spaces in Maine, we don't have much to offer them. We can't even fill our own need right now. It's a lot going on and a lot of work. So all the spaces are kind of heads down, working hard to do what we can.
Well, we appreciate all that you're doing. And just before we wrap up, I'd like you to just discuss at one more time the ways that people can reach out to you if they have needs or ways that they can help participate in what you're doing. How can they contact you?
You can email makerspace at sau39.org. That'll email a whole group of us. You can visit our webpage, www.amherstmakerspace.com, or you can look up the Amherst Maker Space on Facebook.
And if people were interested in trying to get those ear savers, how might they go about doing that? By contacting you at those places to help them?
Yes, please.
Okay,
and we're
wonderful.
glad to deliver as many as we can manufacture for you.
That's fantastic. I wish to thank you and your organization very much for all that you're doing. You know, it truly takes a community to help a community, and everybody that's stepping up is really just fantastic. And I want you to know that we appreciate the talent and skills that you bring forth, your time, your professionalism, and the efforts to really help all of our community people, our frontline people, our people in our hospitals, and all of us really get through a very difficult time. And we know that your response is not only in this time of COVID-19, but that emphasis is now, but that you also do a variety of things related to your creativity. Have we missed anything else that you wanted to share with our audience?
Oh, I think we have it covered. We just really appreciate the frontline workers out there that are putting their lives at risk to try to serve their community and help people. It is all that we can do as makers is to make things and to try to help in any way we can.
Well, thank you very much for all that you do. We greatly appreciate it. And to all of us out there that are listening to the show, I'd like to thank you all for the role that you're playing, not only within your own homes related to staying safe and keeping a social, physical distance, but also the other things that you're doing coming forth into our communities and helping share your skills, your time, and your talent with our community in order to support all of our healthcare workers, all of the people on the front line in every facet, in every way, and also how you're helping each other and caring for each other. It does take a community to support one another. And in times like this, We learn so much about the quality of people, the intent of people, and how they come forth to help each other. So may we all be safe, may we all be healthy, may we all be happy, and may we all live at ease. Thank you very much for all that you do. Take care and be well.